5 things we can learn from the killing of Brian Thompson. Did you know that the United States spends significantly more on healthcare than any other developed country? And yet, it has some of the worst health outcomes. That tragic reality is brought into sharp focus by the killing of Brian Thompson, the CEO of UnitedHealthcare. Today, we're going to explore the 5 things we can learn from this tragic event. Simmering rage. The killing of Brian Thompson wasn't just an isolated incident. It exposed a simmering rage directed at the U.S. healthcare system. While official statements mourned Thompson's death, the online reaction revealed a stark contrast. Some people even celebrated his death. It was as if they saw his position, leading the nation's largest health insurer, as representing everything wrong with healthcare in America. Denials, delays, and despair. The phrase delay, deny, depose, found on ammunition near Thompson's body, became a chilling symbol of the tactics critics say insurance companies use to avoid payouts. It speaks to a system where profits seem to take precedence over patient well-being. The suspect, Luigi Mangione, cited UnitedHealthcare's denial of his mother's insurance claims as a major factor in his actions. His manifesto echoes the experiences of countless Americans who've struggled with claim denials, prior authorization hurdles, and a perceived lack of compassion from insurance providers. The allopathic complex. In his manifesto, Mangione railed against the allopathic complex, his term for the dominant Western medical system. He felt this system, heavily reliant on pharmaceuticals and expensive procedures, failed to help his mother suffering from neuropathy. This criticism underscores a growing dissatisfaction with the traditional medical model, even as alternatives struggle to gain widespread acceptance. A global perspective, the U.S. healthcare system stands in stark contrast to those in other developed nations. Despite spending significantly more per capita, the U.S. lags behind in key health outcomes, including life expectancy. In other words, we're paying more for worse results. This begs the question, what can the U.S. learn from other countries that achieve better health outcomes at lower costs? Some countries prioritize preventative care and chronic disease management, ensuring affordable access to healthcare coverage, and implementing cost containment measures. Perhaps it's time for the U.S. to take notes. The power of social media. The reactions to Thompson's death played out in a very public way on social media, becoming a lightning rod for the broader debate on healthcare. This event reminds us of the power of social media to shape public discourse, amplify frustrations, and, sometimes, bring disturbing sentiments to the forefront. Social media can be a double-edged sword. What do you think about the state of U.S. healthcare? Leave your thoughts and horror stories in the comments. It can be a valuable platform for raising awareness and advocating for change, but it can also devolve into a breeding ground for negativity and harmful rhetoric. Don't forget to like this video and subscribe to the channel. Hit that notification bell so you don't miss out.